Right, karibu sana. This is Morning Cafe. I'm yours truly, Stanley Nyarungiti. It's a Monday. We're discussing matters health. Before the break, we were getting in to understand how your dentition looks like, matters dental fluorosis. And right now I want to get into a conversation when it comes to matters first aid, because this is what we do every single Monday around 9 a.m. Just giving you tips on how the first aid should really be looking like. And ushaipata cut, mahali kwa skin yako. Ukashanga, how do I even treat this? And you didn't even have bandages or any first aid kit around you. Or you probably got burnt, ile ulishika sufuria moto, or probably a very serious, a burn, and you didn't know, how do I treat this? Well, we're giving you those tips today. Leila Wabwira, a first aid training officer at St. John Ambulance. Karibu sana.
Thank you.
So who is Wabwira? Before even we begin this conversation, who is Wabwira?
Well, it's Nabwire.
Oh, yeah.
So,
okay, sorry.
Yes, Leila Nabwire is basically speaking a humanitarian, a lover of saving lives. Mm-hmm. So I'm currently working with the St. John Ambulance as a first aid trainer. And my basic area of focus is matters to do with safety at home, safety at work, and any other social spaces that people interact with. Mm-hmm. Yes.
Oh, yes. And I think personally, I've had quite the cuts and burns. Sure. And around you don't even have any bandages. And I'm pretty sure in most domestic, places that, and even in, even in workplaces, that often happens. But then first, tell us, first off, what's the first thing that you do when it happens? Either you're alone or you're with someone who has had quite the cut and also the burn. What's the first thing that you do?
All right. So in most cases, when we have such situations like cuts and burns at homes, most people end up panicking, especially looking at the severity of the injury or the kind of the blood that is coming out. So the first basic thing I'll advise a person to do whenever they have come or they're encountering such is to calm down first. And then the second thing is to try and alleviate or eliminate pain as well as control the bleeding. So basically what I will say is calm down, be in control, do not panic because of the amount of blood you're seeing or the kind of the injury you have sustained. And then the next thing is now let us focus on reducing the pain as a result of the burn or reducing the amount of blood that is coming as a result of the bleeding. Mm-hmm. So basically that's what I'll say. And also another important thing is ensure safety, because whatever that has caused the initial burn or whatever that has caused the bleeding could cause further injuries. Uh-huh. So make sure that if it was cooking oil, you turn off, mm-hmm. keep away from the cooking oil. If it was something that fell on you and then cut your broken glasses that cut you, make sure you clear the scene for further safety. Mm-hmm. Yes.
Calm down is where I think now most people would be drawing the line. Sure. But then, tell us the kind of levels that there are when it comes to a cut and also a burn. You can start for separately. Right. Because kuna na ile tuka cut kadogo ka ule umeguarizo na msumari, and you probably would be like, this one will heal on its own. First of all, again, will that be advisable? And also even for the burn, what kind of levels are there to it?
All right, so let me start with cuts. I would say there are different types of cuts depending with how or what has injured you. Like for example, when you're in the kitchen and you slice yourself with a razor or let's say a knife, depending with how deep the cut went will determine whether you're going to have massive bleeding, which we'll call severe bleeding, or just a slight cut, which will be a minor bleed. Mm-hmm. All right. Also, as you said, if we have a nail puncturing you, that will be completely different from a sharp edge, like a knife. Yeah. Or if you have a barbed wire lacerating you, that will be completely different from it being bruised by a blunt object, let's say like a hammer. Mm-hmm. So it depends with what has injured you and what is the severity or the impact of the injury. And as such, it will lead to two major types, severe or minor. Mm-hmm. And sometimes you also have what we call internal bleeding as well as external bleeding. Uh-huh. Internal is that which you see. Internal is the one that you don't see. The blood doesn't come out of the skin, while external is the one that you see. Mm-hmm. Yeah, so both of them can either be minor or it can be severe. Right. So that is for the cuts. While for burns, there are four major things that determine.
Actually, before now you cross over to burns.
Yes.
Because when you say, first off, for the minor kind of injuries, mm-hmm. and cuts. Yes. Mostly as Ben utasema mimi mbona nianza kuweka elastoplast hapa, hakuna haja, hii itapona on its own. Is that advisable? And it's a small cut. It's an open wound, but then you're like, haina uchungu sana.
Yeah,
Will that be advisable?
Most of the cases, we usually overlook those small cuts and abrasions that we sustain. But I'll advise you, any kind of wound you get, whether minor or major, it is always important to protect it and cover it from infection. And therefore, dressing and bandaging and cleaning that wound is very, very important. Because it could be very minor, but at the end of the day, it might end up attracting infection and therefore leading to a major or a serious wound. Plus, also, another thing is, whatever that has injured you could have rust. So there is a risk of getting tetanus and other related infections, and therefore it's not good to overlook small cuts.
All right.
Yes.
Now, still on cuts and the whole bleeding, how will I know that I have internal bleeding any part of my body?
Well, that has been one of the most toughest or the hardest nut to crack for most of the people. And most of the times, many of us have suffered internal bleeding, but we've just overlooked it. But internal bleeding is one of the most dangerous and very fatal types of injuries you can ever sustain. So one of the things that you can be able to use to identify that you're having an internal bleeding is, number one, a presence of a bruising. A bruising, what does that mean? A discoloration on a part of the body that has been injured. Let's say, for example, if I hit my head so hard and then all of a sudden it is swelling and then it is starting to change color, that could be a sign of an internal bleeding. Another thing is when you see blood coming from the openings of the natural openings of the body after an injury. Let's say, for example, you're bleeding from the ears and the blood that is coming from the ears is not the normal fresh bright red blood, but rather it's a thin watery blood. That is a sign that you have had a skull fracture from the head. Or the same as blood coming from the nose. Not the normal fresh bright red blood, but a thin watery blood is a sign that you've had a head injury. You're bleeding from the inside. The same way, if you vomit a blood after an injury and the blood is about brownish in color, that means you've injured the abdominal organs. And if you cough blood and the blood has some froth on it, that means you've injured your lungs. So when you bleed from the natural openings of your body after an injury, it could be a sign that you're having an internal bleeding. And then the last thing that can help you know that you are having an internal bleeding, basically speaking, is a sign of shock. So what is shock? Not the shock that we are accustomed to. Guy, I was so shocked, not that time of a shock. But this shock that I'm talking about is where the major organs of the body are not receiving sufficient blood. And therefore you exhibit some signs. Like, for example, after an injury, you do not see physical bleeding, but you feel sweaty, you feel thirsty, nauseatic, dizzy, your skin is clammy and sweaty. Those are signs that you are going into shock. And it could be that you're bleeding from the inside. And therefore you need to be to receive emergency help as fast as possible.
How long does that take before you get into shock?
Depends with the severity of the bleeding. There's some bleeding, when there are too severe bleedings, you may go into shock immediately. When you lose a lot of blood, you may go into shock immediately. Sometimes a prolonged bleeding, it could be minor, but prolonged for a longer duration of time, then shock may progress. So it depends with the severity of bleeding.
Will it get into days or just hours?
No, it does not take 2 days. If you're experiencing bleeding, usually within the first 1 hour, you should be able to exhibit signs of shock.
All right, all right. So now that's when it comes to matters cuts and the kind of levels into it. So let's get into the burns.
Yeah.
What are the levels of burns?
Now, with burns, that's also a very critical area that we always handle casually. It's important I let us know the following, that a burn is just not a burn, but there are various factors that you need to consider. So when you talk about the different levels of burn, number one, we look at how deep is that burn. Because we have a superficial burn, and then we have a partial thickness burn, and then finally we have a full thickness burn. So the superficial burn, basically speaking, involves the top layer of the skin, which is the epidermis. That is one of the most painful burns we experience. And then the second layer is the epidermis has burnt, that is the partial thickness burn. And then the full thickness burn is where the subcutaneous layer has also been burnt. So that one, most of the time, is characterized with less pain, because the nerves have been already damaged. So that is one factor that you may have to consider in terms of burn. Another thing is also issues to do with the severity, as in how large is the burn, the extent of the burn. So we always say a burn more than 2% is very dangerous. 2% is equivalent to your palm size. So if you sustain a burn more than 2%, it can be very, very dangerous to your life. Oh. Yes. Another area we also consider is the location of your burn. There are areas, if you burn in your body, it may lead to disability or even death. An example is the airway burn. When your airway burns, there is a high risk of your airway to swell up, and therefore this may impede you to breathe. And if you're not able to breathe, you may go into a cardiac arrest, and this may lead to death. If you burn your eye, there is a high likelihood of you being blind at the end of the day. If the burns to your limbs, the hands and the legs, there is a high likelihood of you becoming impaired. So we also consider. So those are the main factors that we usually consider whenever you are handling a burn.
And so now, are there, let's say, different kinds of even for the burn, the effect of that particular burn? Because you'd find, for example, the acid, burn on it. Maybe if it's a fire, there are different types of fire, and even the causes that probably have on that, the fire. How different is that, even on the skin?
Very true. Now, again, this brings me back to this, what I said initially. Whenever you have somebody who has had a burn, it's always important for you to assess that burn. Other than the three factors that I've already mentioned, that is the extent of the burn, and that is the depth of the burn, as well as the location of the burn. Our fourth factor is always what has caused that burn. I agree with your statement that, yes, different causes injure your skin differently. Like electrical burn is completely different from a dry burn. A dry burn is the flame itself. And a scald is a burn from moist conditions, while we have a chemical burn also that affects you differently. So the difference here comes in terms of, number one, management and how deep the burn went. Most of the electrical burns may be accompanied with a lot of multiple injuries like fractures and so on. Scalds depends with how long you have been. Scald is where you burnt by a moisture. So like, for example, Majimoto, or let's say cooking oil or fats, hot cooking oil or fats. So if it burns you, it depends, number one, with how much of it, for how long. So the longer and the more it is, the deeper the burn is going to be and the larger the burn. The smaller and the shorter, the smaller the burn and the lesser, deeper the burn is going to be. So those are factors. Sun also the radiation itself can subject you to a burn.
Oh, for real?
Yes, cold also can also burn you. So it's always important for you to understand what is the cause of this burn. Is it electricity? Is it a scald? Is it a dry burn? Is it a chemical burn or radiation burn? So all those factors must be, because all of them affect your skin differently. Yes.
And just to get more context on this, and take you to events that most Kenyans would really relate to, as much as it can really be, as much depressing and all that. The Embakasi fire incident that happened this year. For the fire victims there, how will you do first aid for them?
Well, for the Embakasi victims, it was so unfortunate that event really happened. We're glad that St. John was present there to help in that situation, actually. So basically what happens there, we do what we call triaging. So triaging is a trend to all the casualties based on the severity of their injury. Because in that incident, there are those ones that had severe burns that were immediately threatening their life. Those ones will be handled differently. Then we have those ones that who had burns that could be delayed. It wasn't so immediate, but they could be attended to. And then we also had three major categories of burns in these situations. And so based on triage, we were able to prioritize the needs of our casualties. So those ones that had injuries immediately dangerous to life were given a first priority. And then we have the second, the one we call the delayed one, the yellow ones. And then the last one, the green ones. That is the ones that the injuries was not so threatening to life. They could survive and they just needed first aid. So we had different setups. We had a tent that attended to the first aid. We had others that provided further help in terms of medical aid that was needed beyond first aid. Yes.
And the reason I was asking this is because now in a hypothetical of, for example, you're attending to a house that it's only one victim and one probability of maybe it was a dry 5 cause of the burn. And again, maybe it's the size of the palm. And so for this victim, you probably give them the kind of care because you have time, because ni moja. Now for this other case, it's a huge number of people here, more than let's say even 200 plus. So how the kind of difference that has.
How do you handle? That is what I said. Triaging is very important. Where we have several casualties, you have to triage, because there are those ones, as I said, there are those ones that have injuries that is immediate, dangerous to life, that must be given first priority. Then there's a second priority, then there's a third priority. So that is why triaging comes in. And then another thing, we also had a very good, like for St. John Ambulance had a very good pool of volunteers that came in. So these volunteers were also given. There are those ones that handle the third priority, the second second priority and the first priority. But if you're alone, it can be quite a very, very difficult situation. And that is why it's important. When you find yourself, we have we call them mass casualties, where we have several casualties that have been burned and you are just alone. We'll advise you to call for help, that is call us or call any other emergency services to come in to help you, because such a situation is quite difficult for you to handle as a layman, in a layman's perspective.
Right.
But on a medical perspective, we use triage to be able to do that.
So now for the triage, the third category, the delayed one. So what do you offer them at that time? Because you're telling them, ngoja hapa kidogo, tushughulikia wengine. This person in this sense, they're wondering why mimi nimechomeka pia tofauti yetu, because I mean they don't really understand that maybe akona a more severe burn. Mimi nimechomeka, umechomeka, si wote tumechomeka. So first of all, what do you tell them at this point? And also what do you offer to them, both maybe counseling and also maybe when it comes to medicine?
All right. So basically speaking, for this third group that you're talking about, whose injuries are not so dangerous, basically speaking, we do first aid on them. We do not neglect them or tell them to sit kando, because they're also still in pain. And mark you, these kinds of injuries usually are first degree burns. They're not so big. They're within this span, say within 2%. So basically what you do is just pour water, because dawa ya moto, tunasemanga dawa ya moto ni moto, but in this case I'll say dawa ya moto ni maji. So just give water, running water for almost 10 good minutes until there is little or no pain. And thereafter we just cover the burn with a dressing.
What's the purpose of the water? So it's cold water?
Room temperature water.
Room temperature,
is good. It should be running water. Now the essence of water is to alleviate pain and reduce the, when you have a burn, it's very painful. So when you pour water on you, it's to cool the burn, basically speaking. So when you cool the burn, it reduces pain. And once pain has been reduced, then we are done with suffering.
Right.
Then we can be able to attend to other needs. So basically speaking, that is the thing.
Right.
Yeah.
And now because we were mentioning about the burns, we can now try and just see for ourselves. Maybe there's one of us alichomeka asubuhi, tuone venye unaweza msaidia.
Very true. We can have a demonstration of a situation where we have somebody who has had a burn, and then what are the steps that you need to follow to handle such burns.
All right.
Yes.
So even as we prep our demonstration and see how severe that is, I mean, first of all, you've given this person, the first aid, running water, the room temperature for about 10 minutes.
Yes.
But then do you also, what are you telling them? Because again, the whole mass casualty, do you tell them, ngojea tafadhali, tutakushughulikia, and also because they're delayed, so how long should this delay be?
All right. Now, it depends with how many casualties you're handling in an incident, because you say triage is something that goes on and non-stop. By the time you finish by the first round, as you are assessing the casualties, by the time you reach to the fifth one, the first one could have gone back to a very serious situation. So basically speaking, we do not have time allotted for how long we go back to the first casualty. But basically speaking, what happens is, by the time you finish your first round of triage, you should immediately go back again to where you started, because by the time you reach to the last person, probably what happened, the first person you began with has become even worse. So that is how triage goes. All right? Yes, basically speaking. So it's a circle. We do not allot a specific time, but it depends with how many casualties you're dealing with. By the time you finish with the last one, go back again to the first one. How are they doing? Then as you continue with your care, it's always important to reassure your casualty. Most of them are panicking, the pain, they're hysterical. So it's always important to be very reassuring, calm them down, and provide them the help that they need with confidence. And with that, is able to calm them down and believe in you that you're sorting out their issues. Yes.
Do painkillers work? And how do you provide painkillers for all these three categories?
Now, when it comes to medication, we leave it for the medical personnel to handle it. At a first aid level, I would like to advise us never to give any medication to any casualty, whatsoever the condition, unless it has been prescribed to them by the doctor. So in a first aid scenario, we usually refrain to give medication from. Why? Because of issues to do with allergies that can end up leading to worse conditions or severe conditions like anaphylaxis. Yes. Right. So basically speaking, we do not give medication whenever you are attending to burns or you're attending to cuts for the sake of anaphylaxis.
So at this point you tell this person, relax,
utenda hospitali.
Kuna mtu atakuja kushughulikia.
Yes. Right. You don't need to give medication. medication.
Right.
Yeah.
I don't know if we can have now a demonstration ready so that we can actually understand how all this works in.
All right.
And see. Hey.
You can have a seat.
You're in a uchungu.
All right, so in our scenario here, we have a casualty who has sustained a burn. It's a severe, see, it's beyond, this is beyond 2%. It's really big.
Oh yeah,
it's severe.
The palm, okay.
All right, so the best way to handle such a kind of a bleeding is simply applying water, running water for 10 good minutes until there's little or no pains. But it is important also as a first responder, or when you get...
Right, I'm being told to hold on first. Even for the viewer, disclaimer, this is makeup. Whatever you're looking at right now, this is makeup, and imekuwa vizuri sana. It might trigger you, so this is just a disclaimer for the pictures that you're about to see. Yes.
All right.
And we might continue.
Okay. Now, one of the most important things you need to do in cases of handling such situation, remember, as a viewer at home, you must always put on your gloves before you handle any body substance that is not of you. All right? So once you've put on your gloves, the next step we're going to do is now go to the casualty and quickly assess the injured hand. Number one, why am I assessing? I'm assessing, number one, to understand what has caused that burn. Number two, to know how deep is that burn. Number three, to know what is the extent, how large is that burn. Because that information and where is that burn, the information that I gather from those 4 factors will determine how I handle the burn. So in this situation, I'll come to the casualty. Hey, how are you? How bad, what happened?
I got burned.
Okay, what burnt you?
It was the Jiko.
Jiko, all right, sorry. Okay, let me just examine your hand just to see how bad is your burn and then be able to provide you the right help. Is that okay? Okay, now the next step I'm going to do, basically speaking, I'm going to take water. I've examined the wound. I'm going to take water. Water is just room temperature. It doesn't have to be ice cold. And then after that, water, and then you go to the casualty.
So you said for about 10 minutes?
10 minutes, yes.
So what's the purpose of the water in this case?
The water is to cool the burn and to reduce the amount of pain. So I'm cooling the burn to prevent further, because you see, the fact that she's just burnt and inside there, the burn could be continuing. So when I pour the water is to prevent further. Number two is to reduce the pain that the casualty is experiencing. That's why we say you pour water until there is little or no more pain, all right? So I'm going to pour water, just running water, gently water. So like that for 10 good minutes. Once 10 minutes have elapsed, the next thing I'm gonna do, I'm gonna take a dressing, or you can use a cling film. At home, you may not have a bandage or so on, but a cling film, we all can access this. If you can't get a cling film, you can use a polythene bag. So you take this cling film and gently come and cover the wound like that.
So what's the purpose of the cling film?
The cling film is protecting the wound from any infection. Another thing, keeps the wound moist, yes, and comforts the wound. So it's as simple as that.
So we've done this for 10 minutes, having the water run, room temperature and everything, now wrapped it with a cling film.
Yeah.
For her, even a facial expression, nayo, now let's say hypothetically it's 10 minutes plus.
Yes.
Should her pain be lesser?
Hypothetically speaking, after 10 minutes, the pain should be lesser. But if after 10 minutes the pain is still much, it means then the burn has gone deeper. So continue pouring water until the casualty tells you the pain has lessened. Yes, right. It's important.
Right. So even as you continue the whole process, because this is just a part of the hand.
Yes.
Now, for example, if it was quite a huge part of the body, from the entire front body, hadi miguu and everything.
Yeah.
Do you still do the whole process of pouring water for 10 minutes?
Now this can be, when we have a whole body, being the person has been burnt almost a larger part of the body, it's very dangerous. This can be life-threatening. So this person will go into shock. When they go into shock, pouring water is not going to help because already the temperatures of the body have been elevated. This person requires even warmth. Another thing, your skin is the one that helps to protect your body against external temperatures like cold. Now it has already been burned. So this person is directly exposed to external or the environmental cold. So if you add water, it's going to worsen the situation. So best thing in this situation, try to find a cloth that is clean and non-sticky and cover that person with that cloth. All right, and immediately rush to the hospital in case we have a big burn like such a situation. Sawa?
Right.
Yes.
Okay.
Now, after you have dressed the wound, like the hand, it's not good to leave the hand hanging like that. So we're going to place this hand in an arm sling. So this is going to keep the hand elevated as we quickly rush our casualty to the hospital. So we simply make an arm sling using a triangular bandage, but at home you can create a triangular bandage simply, like for example, if this is my top, I can just insert my hand in it and it becomes a sling.
Okay.
Yeah, so you can use a belt, you can use a rope, whatever that you can find to make a sling, but it's always important after helping a burnt hand, especially for the hands, you must put that hand in a sling. So this is a simple sling. Then you secure it like that. So the casualty now can comfortably be taken to the hospital. Make sure that the circulation is okay. Yeah.
So how do you know the circulation is okay? I've seen you look at her fingertips.
All right, what I did is just what we call, you press the finger, you press the nail bed a bit tighter for a while, then release. See how long does it take. It's called a cup refill. So when I press it, it becomes white. Then when I release it, the redness comes back. So if the redness takes a while, then it means there's a problem with circulation. But if it refills within seconds, then circulation is okay. Yes. I
was trying to see if my blood flow is okay. I'm a mgonjwa. Right. So we've done that, but the other hand is still burnt.
So this is a different scenario of cuts.
Oh, cut. Okay.
Yes. Yeah.
All right. So alikuwa na jiko ikamchoma.
Yeah.
Na bado sijui nini, labda tuambie kitu ilimgwaruza hapo.
Yes, so lazima muulize, ni vizuri uassess. So ukifika mtu kama ni wewe unasaidia mtu, it's always important that first you ask them what happened. So you understand, is it an electrical burn, is it a scald, is it a dry burn, is it a chemical burn? For chemicals, instead of doing the water for 10 minutes, you'll do the water for 20 good minutes.
So what in a case where this person is unconscious and they can't actually verbally talk to you? Or, I mean, you'd find someone who is unable to talk. Maybe they use, sign language, but then they are unable to use sign language because, well, maybe part of the hands is burnt or maybe cut, and they are alone. What happens?
Now, there's a process we call a secondary survey. You have to do the assessment yourself. All right, but keep the fact that they are not able to talk maybe they're using sign language does not mean they will not be able to listen to you. So you'll not ignore the casualty, but I have to introduce myself to them, tell them my name is Leila, I'm a first aider and I need to help you. All right, so I'm going to assess the casualty top to toe just to look where the injury is. Once I've gotten the injury, I'll try maybe asking, like, what has caused the burn? Is it also looking at the environment where you found them can give you a tip. So there are a lot of things that can help you know how the casualty has been injured. Number one, external clues. Number two, history. There could be people around to tell you what happened. If there are no people, just look at the environment. If they were in the kitchen, you can see cooking oil. That could be a hint. It's a burn.
Right.
Yes, and another thing, you can just do a physical examination yourself. All right, so by looking even at the burn itself, you're able to tell. Like for example, a scald, you'll always see blisters. All right, a dry burn, you'll always see the skin is just dried on the skin. Electricity, you will see some blackness or brownness in color. So yes, those are some of the things that can help you to tell.
So meaning if you came into her house and maybe alikuwa kwa sofa, maybe unconscious, or she could actually talk to you.
Yes.
Okay, hypothetically she was unconscious.
Yeah.
And ako hapo. But then maybe she has clothes on and everything. You'll still have to do a full physical examination to ascertain this is the ban that I've seen, but then there might be others.
Now, in such a situation is a little bit different. When you find an unconscious casualty with a ban, at that moment, the ban is not the priority. There's something else that is a priority, and that is breathing, circulation, and airway. Because there is no need of you attending to a ban when somebody's heart is not working or they are not breathing. So at such a situation, I will begin by, number one, assessing the situation, ensuring safety, that I myself do not get injured by the same thing that has injured the person. The next thing, I have to come and check if they're responsive. So there's a way in which you check for response. You can either clap, call them, tap them, see if they're responsive. If they're not responsive, then you can confirm indeed they are unconscious. The next thing, I'll gently open their airway and check if they're breathing. So if they're breathing, good news. If they are not breathing, I have to start what we call CPR, all right? So if they are breathing, the next thing I'll check is a circulation, just to see if they have a pulse. If the pulse is present, the next thing is now I can see if the ban is evident, I can see the ban, then I go direct to the ban, all right? So quickly I will do what? I will address it, and then after I've addressed it, the next thing is, could there be any other injury somewhere else? So for me to be sure that there could be any other injury somewhere else, I'll start again now from top to toe, checking, all the way, just to make sure that there's no any other band somewhere else.
And in the process of checking,
yes.
For example, she was wearing, a long sleeve, clothes. And in the process of kujaribu kupika githeri kwa jiko, akachomeka hapo, but then part of the cloth has also stuck on the skin very tightly. Yeah. So what happens in that scenario?
Now, in situations where a cloth has stuck in a bun, do not attempt to remove. Leave it there. All right? So that is why, one of the things that you need to do whenever you're handling a bun, for example, if it were that her hand, she had this, her blouse was long-sleeved, one of the things I will start by doing is exposing, removing the cloth first. But in case in the process of trying to remove the cloth, I realize that the cloth is stuck on the bun, do not remove it. Because if you remove it, it's going to pull out skin, and this can cause severe bleeding that may be difficult to control. So do not remove anything. In case you find a cloth that is stuck on a bun, leave it as it is.
Does the pouring water for 10 minutes, does it also work on this?
Yes, it will work. You'll still do everything the same way, except that you do not remove the cloth that is stuck on the bleeding. Right. So just pour water. In case they have jewelries, you need to remove them before the hand swells or anything that is tight around the area that has been burnt.
Right.
Yes.
Right. So we've got the whole hypothetical. She was trying to cook githeri, jiko na makaa ikafanya nini, ikaanguka hapo.
Yeah.
But then akijaribu kusevi yote na sufuria githeri, kisu ikakuja kwa mkono mwingine. Ikaangukia hiyo mkono mwingine. Na damu ikafanya maneno.
All right.
What happens now to this?
Now, for bleeds. So in this situation, I like that hypothetical scenario. So in these situations, now imagine she has also sustained a cut. All right? Now, when somebody has sustained a cut, the same procedure follows. Arrive at the scene, assess first. Understand what happened. Because the very thing that has led to the cut could be the very thing that can also lead to your cut. Then once you've assessed and understood what has happened, make sure that your scene is safe, no more danger.
Right.
All right? Then go to the casualty. Once you arrive at the casualty, if your casualty is responsive, as she is, she's able to talk to me. So I'm just going to ask her what happened, and then I'm going to do a quick assessment of that hand to see how bad is it. Because sometimes the cut could be here, but there could also be a dislocation in that process. Right. So if I focus here, in the process, I might end up causing further injury to a dislocated arm.
So even as you continue,
yes,
because mimi nataka nijue maneno ya first aid.
Please go ahead.
Can I now be your assistant?
Please come ahead.
Unifunze how to...
You can have gloves. That is important for yourself.
Okay. Ama labda gloves ni ndogo.
Zinatosha.
Hakuna point gloves inakuwa ndogo?
No, kuna kuanga na point. These are medium sized. Kuna kuanga na large na kuna small. So ukipata mkono yako ni kubwa sana, unaweza tafutiwa gloves ambazo zinatoshana na size ya mkono yako. But these ones are medium, so they fit most of the hands.
I knew I could never do medicine because of this.
Of gloves. All right.
So as your assistant, nitakuja hii side. Ndio pia mimi sasa unionyeshe how to... Today I'm Dr. Stanley. Feels good to say Dr. Stanley, by the way. All right, so back to the cut.
Sawa. So the first thing you're going to do is examine this hand, all right? So if we are two, he can help me hold the hand while I examine, just to make sure that there are no fractures anywhere else. I'm going to feel, is there any pain here? All right, any pain? If you feel any pain anywhere, you let me know. Is that okay? All right. Don't worry, help is on the way. The ambulance will be here soon, okay? So how do you feel here? This is painful? Okay, I think it's because of the burn, all right? Then we need to assess the whole hand too. So can you assess the hand? Assess the hand. All right, so you just feel the whole arm confidently. Okay. What are you checking for? Injuries? Okay. I check for cup refill. Remember cup refill?
Oh, yes.
Yes, check the cup refill. You use the thumb. You use the thumb to check for a cup refill. Very nice. Now, once that has been done, the next thing we're going to do is quickly, we are going to cover the wound. We are going to cover the wound with dressings like this. Then you apply direct pressure. So the first thing is arrive at the casualty, assess the situation, ensure the scene is safe. The next thing is now go to the wound of the casualty, examine that hand. We have examined it. Now the next thing, we are going to cover this wound and we are going to apply pressure. So how do you apply pressure? I want you to put your hands directly above this, then pressure, and then we elevate it. So this is how we handle a cut.
So why are we elevating it?
We elevate it, this gravity, basically speaking. We don't need more blood going there. So we do it to resist gravity so that blood doesn't flow to the injured hand. So we apply pressure to control bleeding and elevate it for reduction of blood flow to the bruise. Yes. Right. So when you elevate the hand, you elevate it for 10 good minutes.
10 minutes?
Yes, for 10 good minutes until bleeding has been controlled. Once that is done, now we are assuming 10 minutes is over, bleeding has been controlled. The next thing we are going to do now is we are going to put a sterile dressing.
So what if it's not controlled, the bleeding, after 10 minutes? After
10 minutes. So we always encourage continue applying pressure, still elevated for another 10 minutes, see if in case something happens. But in severe bleedings like amputation, bleeding may be so difficult to control. And as such, we have another alternative, which we rarely advise, that we only use it on extreme circumstances, and that is tourniqueting.
Tourniqueting?
Yes, that is you tie it so tightly so that blood doesn't come further. But we usually discourage the use of it. You only use it in extreme situations where bleeding is completely difficult to control. Right. Yes.
So before we have that, a quick one. Let's assume the 10 minutes you mentioned, your PSC choke shoulders. So what if whatever had cut in here, the bits, maybe there's a very slight piece that got lodged inside there?
All right. So that is a different situation where we call them embedded objects. Now that one, if let's say for example it's glass and it's embedded inside this wound, you don't pull it out. If you pull it out, it's going to lead to severe uncontrolled bleeding. So there's another way in which you can handle that. That one we approach it through making of something called a donut ring that we place over the embedded object, press down, and then secure it like that. So that one, you don't cover it like this. You're going to cause further injury. You don't pull the object out. You prepare something called a donut ring that you make.
But then, I mean, if you're at home, for example, and help can't really reach your way, unataka kukimbiza mtu hospitali, lakini damu bado inaendelea kutoka. What do you do? And you don't, have all those donut thingies and everything.
You can always, it's not a big thing. A donut ring is simply made by a piece of cloth. You can just take a piece of a handkerchief, a clean, let me open this a little bit. A donut ring is not something complicated to make. It's something very, very simple you can make from anything. Now you see, with first aid, most of the time we are at home, we do not have these things. So it's always good to improvise. Don't be afraid to improvise as long as it's clean and it does not cause further infection. So it's just a circle you make. You know the way the donut looks like?
Oh, yeah.
Yes, so you make, you just weave something that looks like a donut. It doesn't need to be perfect, but as long as it's able to meet the objective, that is the most important bit about a donut ring. All right? So you can improvise anything. Even at home, you don't need to have these dressings. If there's a clean handkerchief, a piece of cloth, place it there. Yes, just use it.
Right. So let's see how the donut ring will look like.
All right. So basically speaking, that is a donut ring. The donut ring, you use it for embedded objects. And embedded objects, I mean by hata ukikatwa, like you find some situations where somebody has been stabbed by a knife. We've seen those situations where an arrow is sticking out of somebody's body. You use this. This is a donut ring. It does the magic.
Right, so you can have that on.
So this is the donut ring. So you make something as simple as this, and then if that object, whatever that is sticking out, just insert it on the embedded object,
right.
and then secure it like that, and then you take it to the hospital. So this is what you use for that situation.
So, so for example,
Yes,
we can have it. So, for example, if it was on,
Our casualty?
Our casualty.
Yes.
Tulisema hypothetical ni alikuwa anapika githeri, sufuria ikaanguka.
Yes.
Kisu na ikaruka juu ikamdunga.
Yes.
But then a bit of the knife was lodged into there. It was embedded here.
Yeah.
So you have placed it there.
This. Yes.
So do you again now have to wrap
secure it?
Another, probably a bandage around this?
Yes, you have to. Just a quick one to show you. So in such a situation, yes, you will take another piece of cloth. Let's not use a bandage because probably a bandage will keep most people off. So we're going to take another piece of cloth, neatly fold it like that, simple like that. Then the next thing is we are going to gently secure the donor tree around the casualty. Now making sure if the object is so tiny inside, it's okay to cover out over the top. But if the object is protruding, just go around the object like that.
All right. Do you guys bend all this?
Yes, I know. So it's as simple as that. But remember the rule of thumb remains, any injury to the arm, you always place it on an arm sling. Remember the arm sling?
Oh, yes.
Here. After all that, you have to place the hand back to the arm sling.
Oh, yes.
So simple as that.
So kama yeye alikuwa na both. So does she work with two arm slings?
Now I can imagine those scenarios where we have both injuries to both sides of the... Yes, you can make one simple, you don't need to make two arm slings, but you can make one arm sling that is able to secure both.
That caters for...
Yes,
for
but be careful not to injure the casualty because the hands may be overlapping on each other.
Right, right. And in a scenario where whatever had pierced the skin went to the other side?
Meaning?
Right. For example, it's protruding on the other side.
You still use the same technique. The donut ring doesn't change. So in this case, probably we shall put a donut ring on this side and then on this other side, both sides that are protruding.
Both sides.
And then we secure it. Doesn't change the scenario.
Right.
Yeah.
But then now, so hypothetical, whatever had pierced came out, for example, and went to the other side. So you have, holes on one end and also on the other side. So does the first aid of the cut still remain the same? Yes.
The thing I told you is do not try to pull an embedded object. However bad and severe it is, do not try to pull it out. So basically speaking, it still remains the same. The object is protruding from this side, coming out through this other side. Make another extra donut ring to hold the lower side of the side that is protruding and the upper side. So we have two donut rings in this case. And then you secure them. Still the same.
Right.
Yes.
So now what happens to her after all this first aid and everything?
Now, once you're through with that, we need to, because we're handling bleeding or burns, so we always advise whenever you're handling bleedings or burns, it's always important to anticipate shock even if you can't see it. So because such kind of situations, shock is inevitable. So as such, how best do we treat a shock? We use what we call a thermal blanket to handle a shock situation. You do not necessarily need, this is the emergency blanket. It's so big. So basically speaking, you take the thermal blanket and cover the casualty. After everything else,
so this is to help her body temperature to...
Yes, to keep the body temperature and to protect her from shock. So that is... So anytime at home you're handling somebody with a severe bleeding or a severe burn, after doing everything that we have shown you what to do, make sure you cover your casualty. You don't need to have this thermal blanket, but you can also use your own blanket at home. You can use a sweater, whatever that is available to provide warmth to the casualty, you can be able to use.
Right.
Yeah.
So technically, now before we had the thermal blanket on her, what could have been her temperature? With the burn and also the cut?
On all that. Normally, this is what we say. I will approach it from a layman's point of view. When you touch your normal skin right now, it is dry and warm. And that is how her skin should be, dry and warm. So what you can just do literally is compare her skin temperature with yours. So if yours is dry and warm, but hers is a bit cold and sweaty or wet, then it means she's going into what? A shock. Simple technique.
All right, all right.
Yes.
Ooh, I think tunafaa nitafute thermal blanket. July season is coming.
July season, eh? Yeah, it's also very good, by the way, for cold. Yes.
Okay.
Extreme cold, you can still use this to sort you out. So basically, that is a simple procedure. Now, we did not handle bleeding itself. We handled embedded object.
Yeah.
So in case you have a cut, where you have sustained a cut, this was an embedded object. Embedded object, we have said we use a donut ring. But now let's talk about a minor cut, pale nyumbani, kwa jikoni, or a severe cut. Now, our scenario, this is a severe bleeding.
Yeah.
So in a severe bleeding, after we have exposed, we have examined, we remember we were applying pressure.
Yeah.
So when you have applied pressure, you elevate it for 10 good minutes. Once 10 minutes have lapsed out, the next thing you take is a dressing. Now this dressing, gently, you are going to do what? To secure. You're going to secure the wound like that. Now, when you tie the dressing, or this dressing, or some people may call it bandage, when you tie it, basically speaking, let it not be tight, but let it be firm enough to hold the bandage, the dressings in place. Then another thing is, when you tie it, make sure your work is neat. It's always important. Make sure your work is neat. Keep on talking to your casualty. Keep on reassuring them. It's very important. So that is it. Then this is for securing.
So even without her telling you that maybe it's too tight or anything, how will you know?
How do you know? Number one, as you talk to your casualty, is it tight? As you tie. They'll tell you, I'm feeling it's a bit tight. Then another thing is, after you have tied, it's always important to check circulation. A tight bandage will impede, you'll find you've lost the pulse. Another thing is, you just feel the temperature of the hand. Realize a tight one, the upper part of the arm will become cold. So those are some of the things that you can use.
So that's in the hypothetical if, she was on the sofa and unconscious and she wasn't able to actually communicate with you.
Yes, if she's able to communicate with you. If she's not able to communicate with you,
you can now.
Pulse, cup refill, and skin temperature. Simple.
Right.
To know.
Right.
Yeah.
So now tumefanya first aid yote. Tuko ready sa kumpeleka kwa ambulance.
Yes.
All right. So walk us through how that happens and the common mistakes that probably happens.
All right.
Maybe hakuwa na first aider there. So what commonly happens there?
Let me start this way. Number one common mistakes that we do is based on the.
All right. Before you continue,
yes.
Let's pick this call from Nakuru. Derek, habari asubuhi. Derek, habari asubuhi. Derek kutoka Nakuru. All right, ni kama Derek, tutafute, and because we are really out of time, you can give us that and also your final thoughts on how we should really take care of matters first aid when it comes to cuts and also burns.
All right. So basically speaking, I would say as Africans, we already have founding myths and misconceptions around how we handle burns, especially burns. I come from a community where we apply urine on a burn, you see? And that is how we've been doing it traditionally, and it's not good at the end of the day. So we are talking about things like applying what we call toothpaste. We are Kenyans, we like toothpaste on a burn.
I remember that one.
Yeah, toothpaste is for the mouth, it's not for the burn, all right? We're talking about flour, eggs.
So it can't help in any way?
Now listen to me. Whenever it comes to a wound, the only thing that can be applied there, basically speaking, is a what? Is water.
Water.
Do not apply anything else. Don't put creams, don't put ointments, don't put pastes and etc. on a burn. It's going to cause infection, and some people may react to them, and therefore causing the wound even worse. So in case we have a burn or we have a cut and you need to put anything on it, for cuts, use water, for burns, use water. Do not exceed that. Number two, when it also comes to wounds, any types of wound, whether it's a cut or a burn, do not touch the wound or the burn directly with your hands. It's not safe to do so. All right? Do not. And then another thing also with burns, sometimes we have blisters. Do not pop those blisters. It will cause further infection. So if you have a burn that it has a blister, please don't pop it. Leave it as it is. Just pour water, cover, and take to the hospital and receive further help. Those are important things that we need to know.
Right.
With regard to burns and cuts.
Right.
Yes.
Your final thoughts, maybe an advice and everything?
All right. Now, basically speaking, what I'll say is there is nothing big about cuts and burns. We shouldn't be worried about them. This shouldn't be a cause for alarm. It's important, yes, to be alarmed with it, but it should not make you panic. Now, importantly of all is at home, please, you can put aside some basic things. Things like scissors, you cannot fail to have them. Clean pieces of clothes, you cannot fail to have them. These can serve you in case of an emergency. However, I can simply advise, get yourself a first aid kit. It's not expensive. It's very, very much affordable. If you visit our offices, like for example in St. John Ambulance, you will be able to get them. Have it in your house. You can be able to use it. Number 2, invest in first aid training. It is a very basic and a very basic course, and it's a life skills and life savings course. So please, if you have an opportunity, come train with train in first aid. It will really help in attending to such situations at home.
Because you're telling them to come and train, where can they get you guys? Maybe his phone number or socials?
Well, St. John Ambulance is available across the country. Our number, you can easily get us through 0721 225 285. Call that number, 0721 225 285. Call that number wherever you are in this nation. You'll be able to receive any kind of help, including ambulance response, as well as trainings, as well as first aid kits.
Mm-hmm.
Yes.
Right. I'm being told you can repeat that number very slowly.
All right.
So that kakuna mwenye anaandika aiandike vizuri.
Sawa sawa, 0721 225 285.
Mm-hmm. All right. Leila Nabwira, asante sana. I've learned a lot. At least leo nimefeel kama doki. Hey. Our patient uko salama? You good? The help has come on its way? Yes, we are taking you to the nearest hospital. You'll be okay.